Hi, everybody, and welcome to Special Topics with Dr. Annette. Today, I wanted to talk about our health and politics. Our health is political, and I know you've probably been paying attention to the news, but there is so much more to our health that we should consider. And I wanted to share a quote with you by one of my favorite authors, poets, activists, and that is Audre Lorde. And this is taken from her journals, her private journals, which she published for us, and they're her cancer journals. And it says, every woman has a militant responsibility to involve herself actively with her own health. We owe ourselves the protection of all the information we can acquire about the treatment of cancer and its causes, as well as about the recent findings concerning immunology, nutrition, environment, and stress. And we owe ourselves this information before we may have a reason to use it. Now, there's so much more to ourselves than just if we are going through a cancer treatment. We've had a cancer diagnosis. There's so much more to our health than that. But what brought me to this whole journey of the Pink and the Black Project, Sister Circle Writers, was my own cancer journey. And so that's why I'm always working to educate and share anything that is important for us as a whole, our community, locally, globally, nationally. It's all important. Our health is important. And I know that we have all been listening to the news, and the news sort of mediates. It sort of sets the trend or the standard for what's going to be talked about. And so we hear a lot about the Affordable Care Act, also known as Obamacare. We've been hearing a lot about Roe v. Wade and the baby formula shortage. All of these are extremely important, but there is so much more to our health. We have to remember that when we think about our health, we have to think about our health in totality. And that's not just for ourselves, but it's for our families, which then extends to our communities. Our health, stress, thinking about childhood obesity, the flu. We know we have COVID-19 and all the different variants, and should we wear a mask? Should we be vaccinated? Smoking, is it riskier than alcohol and drinking and all those different things? So there's so much more to our health, and of course our safety. Our health includes our safety, our everyday safety, when we're going out and about. Our safety, our health also includes this gun legislation and everything that's going on. So when we think about our health, you might be asking yourself, what is public health? Well, public health is defined as laws, regulations, actions, and decisions implemented within society in order to promote wellness and ensure that specific health goals are met. Public health policies range from formal legislation to community outreach efforts. And so if you're really engaged with your community and knowing what's happening, you know that there's an organization, a group, or even an individual that's trying to work to make the community a healthier place. So public health policy plays a role in multiple sectors, including sectors, that just means where you can find it, places like healthcare, your insurance, policies related to education. Yes, public health also touches our education, agriculture, where our food comes from, whether we're growing it or whether it's the animals that you're eating. Business, and there's so much more to it. So a clear public health policy definition can be hard to pin down because it's so many organizations and the government and hospitals and just so many different organizations and places are involved. It's really hard to get a real specific definition, but the one that I provided for you, what is public health policy, that gives you a broad coverage of that. So it's the core of everything because we have so many different organizations involved from, like I said before, agriculture, farmers, big business, small business, insurance, education, and healthcare, of course. So organizations such as the World Health Organization or the Centers for Disease Control and Prevention, the Food and Drug Administration, the FDA, and other government and non-government agencies play a big role in our public health policy. These organizations perform research and they have different types of educational and health outreach initiatives. And that all helps with our creating laws and policies that ensure society has nutritious food to eat, clean water to drink, vaccines for the sick, and access to health care. So that public health policy is important and it's crucial. Public health policy is crucial. It brings the theory and the research of public health into the practical world. So what that means is all that book stuff, all that research stuff, public health policy brings it for everyday folks like us. So we know what's happening, we know what's going on. And we have to be attuned to it. We have to look for it and we have to find it beyond what's being said on the news or in social media. We have to look beyond that because it's so much more than, the 10 seconds or 30 seconds that's provided in the news or in those little social media hubs or hotspots. So public health policies create action from research and find widespread solutions to previously identified problems. So when there's a problem identified, whether it's obesity in teens, diabetes, heart disease, something's going on with the food, what's going on, what's happening, it's researched. And then that research is brought to the public. It's brought to us. So as a public health policy official, your official, the person that represents you, they're responsible for initiating strategies and policies around both health intervention and prevention to allow everybody to flourish and be in their best health. That's mental, social, and economic. All of that is part of our public health. So it's important that you recognize who you're voting for and what they're voting for. So that as a citizen, part of our responsibility is to know who we're voting for. So that's going to take some time, effort, and research. So public health policy examples are food safety policy. Food safety policies are important to the general health of everybody. I mean, think about it. The recalls on the spinach, the different recalls on food, someone, policy or legislation, put that in place so that we can have healthy food on our shelves when we go to the grocery store. So food-related illnesses are a significant concern, and it's the job of the public health officials to formulate policies to ensure that only food that is safe for consumption is made available to the public. Another example is tobacco use. So depending on what generation you're born in, you're from, that you can recall from parents, grandparents, great-grandparents, smoking was really in and then it was out, and now we have these different vapes. So tobacco use is one of the areas of public health concerns. So many public health officials have put in different measures to reduce the risk of deaths and illnesses caused by tobacco consumption and smoking or secondhand smoke. And some of these policies include increasing tobacco prices. Yes, the cost of your tobacco is legislated. And creating tobacco-free areas and communities to protect non-smokers from the effects of secondary or secondhand smoke. Another example is HIV. Public health policy plays an important role in educating the public about HIV prevention. So you might find a lot of different community organizations that have education around HIV prevention. So how to live with the virus, treatment options, and preventing the stigma that goes with that. So public health policies, including increased access to testing, birth control, and medicine, have been implemented to drastically reduce the impact and spread of the virus in various communities. And the last example I have for you is alcohol. Alcohol abuse is one of the leading causes of vehicular accidents, violence, sexual assault, health complications, and more things. Public health policies are crucial in the fight to curtail, to stop alcohol dependence and reduce the negative impact it has on the users and those around them. So policies on alcohol differ depending on the community, but the most common examples are age restrictions on who can purchase and consume alcohol. So as you think about public health and policy, we know that we have another midterm election cycle is coming up, and then the big presidential election is coming up. So who represents you? Who represents you? Who represents you in the best possible way as far as your health goes? That's just one area to think about. That's what I'm focusing on here in this special topic. So thinking about who represents you. And if you need some assistance with that, I have a free digital book that you can download. You just give me your email. I won't spam you or anything like that. Just provide your email, your contact info, and I'll send you a link for this free digital copy of A Civics Review for those who have considered politics and the rest of us. So it's just a great book that's going to walk you through just some questions about, the different branches of government. You might need a review on that. The Constitution, the Bill of Rights, the amendments. And then there's a few phone numbers and other resources, depending on where you live, where you can actually go through and find out who your county, state, congressional reps and your senators are, and any other things you need to make a note of. So yeah, just click that link below, or you can go directly to AnnetteMadlock.com, and you can sign up to receive the free digital copy of this book. But hopefully you will subscribe to the page, and I look forward to sharing some more information with you again soon.